Carlos and Dana.
Did you know April is National Autism Awareness Month? You may have seen a lot of people showing their support for that and providing awareness. Well, also, did you know this? 1 in 68 U.S. children have autism spectrum disorder. Now, this is a 30% increase from 2 years ago, and this is according to the Centers for Disease Control and Prevention. On the KXNT hotline this morning, we have Dr. Justin Maxwell, a family physician with Healthcare Partners. Good morning.
Good morning.
Well, let's talk about this. I mean, it seems like with so much awareness over the last few years, you would almost see possibly a decrease, but we're seeing an increase. 30% is a pretty big number.
It is. It's also important, though, to understand how they come up with the number. What they do is every 2 years or so, they count the amount of 8-year-old children who have autism in about 11 states. So that statistic is not a true representation of the entire United States, but it is a good estimate of kind of what's going on. And we think that the rise in autism is actually due to more of an awareness, more screening, and just understanding autism more.
Right. You mentioned screening. What are some of the symptoms that some toddlers might have?
The symptoms do vary. We do call them red flags. A couple of red flags should be not responding, say, to their name by 12 months of age, avoiding eye contact, wanting to be isolated or alone, having difficulty understanding other people's feelings or talking about their other feelings. And sometimes we see what's called echolalia, which is repeating words or phrases. Example would be, say, do you want a soda? And they repeat the question and then they repeat it and then answer it. They can get upset over minor changes, anything that messes up a specific routine. Flapping of the hands or rocking back and forth can also be seen. We can see flat facial expressions, and some people can actually be very, very sensitive to touch. So there are a lot of things to look out for. Those are just some of the common things that we see.
And it's all about education, people knowing these things. And some people might think, well, so there's not a test that they can do at 2 months old for a baby to have, do you have autism or not? You're saying that it happens around 12 months that symptoms and red flags begin.
And it could even be earlier, and that's why it's important that parents are taking their children into the pediatrician, because what they do is they assess the developmental milestones at the 2 month, the 4 month, the 6 month, the 1 year or the 12-year mark. Mm-hmm. And if there is anything that is out of the ordinary, the child will then be screened or sent to the appropriate healthcare professional to make sure that they don't have autism.
Mm-hmm. And then I was looking at the numbers here for Southern Nevada. 4,600 children between 3 and 18 years old in Nevada, the whole state of Nevada, have autism. How is that? Is that a large number, or is that typical for other states of our size?
I think it's typical. Again, in 2000, between age 3 and 21, it was about 1.29%, and now 2012, 2013, that jumped to 9.29%. So the question is it just becoming more prevalent, or are we screening for it more? Is there a greater awareness? And the other thing too is we have to make sure that we're not diagnosing kids with autism, but they may have similar features of autism, like social anxiety disorders, ADHD, or other problems. It's not autism, but we're diagnosing them with that. So that's why it's very important that kids are being diagnosed by the appropriate medical professional.
And we do have to run, but really quick, can you just tell me, because a lot of people are probably wondering, mothers and stuff, is there anything you can do to prevent it? I know that's something that people often ask. When I'm pregnant, is there things I should be doing?
Anything, I would say avoid alcohol, take care of your, just the very basic stuff, take care of your health, exercise. The most important thing, though, is to make sure that you get the diagnosis of autism as early as possible. We are still failing at that. We're still diagnosing autism over the age of 4. We should be diagnosing kids a lot earlier. And once you diagnose them earlier, you have a better shot of improving autism, because there are a lot of programs available that can teach the children social interaction skills, things like that.
Thank you so much, Dr. Maxwell.
You're welcome.
That's Dr. Justin Maxwell, with family physician with Healthcare Partners. It is 7:20.